We're going to talk today about your procedure after what's called a facelift. Remember, the term facelift really refers to the neck region in this area. My facelifts feel very, very tight in the first week, particularly the first 2 to 3 days. It may be even hard for you to open your mouth. That is normal. It doesn't hurt per se when you open your mouth. You can't open too much. I want you not to open your mouth too wide. Don't fight against my sutures. You can break them. So I want you just to be on a soft diet for the first few days. I want you to be on some some Ensure or something with high protein, high calorie count that can help sustain your health and expedite your recovery. Ensure, ENSURE, is a great dietary supplement, and you may be just being on Ensure for the first 2 to 3 days. That tightness sometimes can be associated with some discomfort, usually not a lot of pain per se, but just a really tight feeling, and it can feel sore. That is normal, and that's something that usually dissipates after the first 2 to 3 days. Sometimes it can linger for the first week. Do not be alarmed. On the night of the procedure, if you feel a lot of discomfort more on one side or the other, or there's a lot of swelling on one side, there could be a little bit of a blood clot inside that area, and you have to let me know the night of the procedure. That's pretty unlikely with this procedure, but something that you should let me know if that does occur. In terms of cleaning the incisions, it's basically the standard type of cleaning. You'll see me the first day after the procedure, and we'll go ahead and clean it together. My staff will help me, and my staff is willing to help you even every day if you can't do it, have someone at home to do it for you. But essentially what you want to do is just gently clean it with peroxide around the ears. Oftentimes I have one under the neck as well. You're going to just gently clean that twice a day with peroxide, with the little Q-tips in the jar that I gave you. Remember not to double dip. This is not a party. You can't double dip the chips. You don't want to get the peroxide Q-tip dirty by cleaning and redipping inside the bottle. And you don't want to clean it more than twice a day. And then after you've cleaned it with peroxide, you want to go ahead and put the bacitracin on there. Keep a very thick coating on there. The thicker, the better. You shouldn't clean more than twice a day with peroxide, but you should clean, you should put the bacitracin on as often as needed to keep it moist. The areas that I'm principally concerned about are the areas in the front of the ear and underneath the neck, if we did that area as well. All that is normal. Remember also that swelling does work its way down the face, so that if we did fat transfer and a facelift, or a facelift alone, both of those things, the swelling goes down the face into the neck area, and that's going to make the neck potentially look a little bit more swollen for the first 1 or 2 weeks before it gets better. The other thing that's really important is that when you look around the ears, the areas that I've tightened and lifted, it's going to look bunchy around the ears. So maybe think about wearing your hair longer to cover it if you're a female. For a guy, the beard distribution, you can't shave for those first 2 weeks. You want to then use an electric razor after the first 2 weeks. But the good thing is that without shaving for the first 2 weeks, that's going to help hide some of that irregularities that occur. Those irregularities dissipate within 1 to 2 weeks. Most of it's gone within 1 week, but really it takes about 2 weeks, occasionally 3, for all those little bunchiness that occurs right here to settle out to be smooth. And so that's important you understand that. Remember that any bruising I can manage in my office with my laser when I see you on the 7th day when I take out your sutures, and the sutures will not hurt when I take them out.